Dr. Bilski, we've talked about dentistry and insurance before. This question is, are dental implants, are those covered by insurance?
Yes and no are both correct answers. There are some insurance companies that pay for dental implants and some that do not. But those that do not pay for the post and the crown that goes into the implant doesn't make sense to me, but that's their exclusion or their inclusion, depending on what plan you have. And just so you have an idea, insurance plans from whatever company you go, they have, example, A plan through Z plan. If you have the Z plan, you're probably not having coverage on your implant. If you have the A plan, you still may not have coverage on it, but they may pay for more of the other services. Okay. And if they do pay for the implant and the post and the crown, then you probably have like the triple A, which is good, is the good plan. So there's so much to even talk on that one subject.
Well,
we could do that all day.
Here's a question then. If somebody's watching there and they need an implant, can they come to you and say, listen, here's what I have. Can you tell me what this is going to cost?
So we always tell our patients or new patients, now, if you have a question and you know of our practice and you think you want to have an evaluation or consultation, that's a non-obligation. While you're sitting with me, Danielle is usually who checks into it. Everything's online, so she can look at your policy and get a report back on what exactly they cover. Yeah. Because we know that we're talking about implants, she would go to the implant section.
Okay.
Look at the code. This is what we do. Yes, your implant would be covered at 50%, 40, 60, whatever it is. And then we could make a plan and give you what's called a treatment plan. And what a treatment plan is this. It's kind of like if you were given a scholarship to go to college. And let's just use simple things. It's $1,000 to go this semester. We're going to give you a $500 book and residency scholarship.
Right.
But you have to pay the college the other $500, Randy. Randy, you need an implant. And we'll get into costs later in another video. But you're going to have a portion that you have to pay, and we know what your insurance is. That's why we check into it. If it doesn't tell us, we can do what's called an authorization for services. What that means is we send the insurance a form with maybe a picture and definitely an x-ray. And I read a little tiny narrative. Randy Zandy needs tooth number 19.
Yeah.
We're going to do some bone grafting, place an implant. This is what our costs are. Please advise on if we can move forward with the payment, not if we can move forward with the procedure. Because you can still have the procedure if your insurance does pay or does not pay or doesn't get back. But if you're really looking for hard numbers, that is the way to do it. And sometimes they come back even with the authorization. Like, no, we don't pay for it. So it just depends on what you want to do, how you want to.
It's good just to know because, you've talked before, what are the three things people always scared about?
They always say, how long is it going to take? Is it going to hurt? And what's the third one? You know that one.
What's it going to cost?
What's it going to cost? And then 3A or 1A is actually the number one. Does my insurance, if you have insurance, does my insurance cover it? Or can I get insurance would be 1B.
Yeah, but at least it's good to know, like anything. So if you want to be in the know, you know where to go. I just made up that, Ryan.
Yep.
You can check.
Hey, and by the way, our staff is really good at this stuff. And it's kind of funny because I always used to comment and we'd kind of bust chops. And they're like, all right, Danielle, how close can you get this? And she was off by 50 cents.
Oh, wow.
Which I think that was amazing.
That's pretty good, all right? That is precise dentistry right there. So Bilski Dental Group, check them out. Check out the website, bilskidental.com, and make an appointment if you need.
Look forward to seeing you.